joining us here, and I do want to extend a special thank you. We in the first group of media as part of that, the ability to get out good information to keep folks updated, timely manner about what's happening. We're out here today to highlight what I think you've seen over the last several days, and unfortunately what we've been predicting for several weeks, that the spread of COVID was accelerating in the upper Midwest, and that we were seeing a long-term trend of Minnesota staying at about 5% positivity rate. We started to see all the indicators that would creep up. We saw surrounding states start to go exponentially up, and that's where we're at today. And as I said earlier, here on the border, this is probably the highest positivity rate maybe anywhere in the country right now. The good news about this is that we've learned a lot about COVID. You heard stories of how it will impact you once you get it. The goal here is obviously to stop and slow transmission to the point where we control it much better. Our original goal was one that is still part of our plan, to make sure that every single person who needs hospital care gets it, every single person who needs therapeutics, and God forbid they need a ventilator, they would be able to get that. Those things hold true at this time. Our hospital capacity is holding, but as I've said continuously throughout this, it takes about 10 days, the lag time of this, to overwhelm the system. What you're looking at is a window that was back about a week, and all indicators show, and I said I hate that this is the way it is, I can predict to you that we will go over 3,000 positive cases in the next week, because that's the trajectory of it. The only thing and the only variable in there that we can control is the behavior of people, of the masking up, of the keeping the social distancing, of the getting tested when you need to. And as we said here, we're going to take Dr. Birx, the CDC's, and the White House Coronavirus Task Force, along with guidance from Mayo Clinic and others. We're going to make a push at those asymptomatic young people to try and stop that, because we think now that's where a lot of this is happening. When you hear these stories of folks doing basically everything right and still getting it, the chances are probably pretty good. I'm sure when they went back at Kenton's event was probably an asymptomatic person in the 18 to 35-year-olds, and that's all it takes. And then it burns like wildfire. So we're going to continue to make sure that we expand the testing. Again, I want to extend a thanks to our partners in North Dakota, especially Governor Burgum and Public Health in North Dakota have been great partners in sharing testing, sharing data, and contact tracing across the border. I think now, though, we're going to have a common goal of how we fight this thing. I find no pleasure in this, and it's certainly, the decisions you make are not politically popular, but that's not why I asked to get this job. My job is to make sure I protect the well-being of Minnesotans. So doing a mask mandate, doing some of these capacity issues have worked. They have slowed the spread, but they're not, as we heard here, they're not without fault. They will not work 100% of the time. They will not work, and no matter if you reduce the risk, if people start to congregate too much, if they think, well, I'll just not wear a mask this one time into a store, that's all it takes. And I hope people recognize what that looks like is, I get how much of a pain this is, but you get out of your car and you go into the Quick Trip to get that coffee without a mask. Every single person in there is at risk, and now all of a sudden you're in Randy's position. And that's how it can happen. Yeah, chances are pretty good, maybe not. Nobody will get it, but you upped the chance of that happening by simply not wearing a face covering. So grateful you're all out here, and sure be glad to take any questions.
Mr. Governor, we're seeing a lot of resistance to mitigation efforts on the Dakota side of the Red River. Do you think more action needs to be taken by local leaders in North Dakota or its community to protect both themselves and your border cities?
Yeah, and I'll speak about this because every leader's been put in hard positions. It's not my job, especially on these levels. I'm not going to criticize anyone. The point where I will make is that I think is inevitable. We need a national strategy on this. We don't need to have, this is one of those things where federally, if they would have done a national mask mandate, it didn't become an issue. It didn't become a fight about this. And there's certain things that I think you go back and look, mitigations we took that might not have been as effective as others, because right now, more transmissions happening in these settings like Ken described than there are in retail settings. So small business who said, maybe we could have been open earlier, I think they're probably right of what we know now. What I would ask is for us to get a national or a more regional strategy around this. But again, I just get to the point right now is I will own things that don't work. We follow the best guidance that we have. Right now, there is no scientific debate around the efficacy of mask wearing. It does reduce the risk. It does save lives. It doesn't cost anything really. And I would just ask people to maybe just go that direction. But I'll not criticize regionally on this, because each of us have been put into this. It is tough. I get on with governors every week, a handful, sometimes with all 50. We have 50 different strategies, 50 different testing strategies. What Dr. Birx laid out for us, they should ask for all 50 states. That's what we should be doing. That capacity, we've had 8 months to do it. And again, each state is kind of on their own on testing.
Can you talk about what the enhanced testing will look like as it rolls out?
Yeah, I think it'll be, and just because of the sheer volume of this, not all tests are created equal. The PCR test, the molecular test get a little more detail. Our Abbott Labs IVX saliva testing is very accurate and works very well. There is an Abbott Binex test, which is the one that the administration had been promoting. It's not super accurate. It's basically 2 lines. It kind of looks like a pregnancy test. Either you're kind of are or you aren't. The problem is there's kind of a middle ground. You either are or you aren't. There's not a kind of pregnant type of thing. And on this one, it kind of works the same. So it's a bit confusing. 80% of the time, it's effective enough. And I think what we're looking at is massive testing, either in, pop-up kiosks in places we can go to, and asking 18 to 35-year-olds, pull over for 30 seconds and take this test. It's really easy, and we get a result instantly. That one we get in 15 minutes, and we can start to break this. And so I think like I said, we're talking hundreds of thousands of tests. The logistics behind this is pretty daunting, about how you lay this all out, how you get the results, how you test. I also talked about combining that with some technology of contact tracing, all anonymous, total protection of this, signed off by the American Civil Liberties Union, others that we looked at. They'd be totally anonymous. If you get it and you get tested positive, a code will be sent to your phone. If you choose, you opt in, you can not. But if you say, hey, I want to be a good citizen here, you push that, it sends an anonymous code to everybody you were near, and they will get the code and say, hey, you were near someone who tested positive for COVID, you might want to go check it out. So that's going to happen over the next few weeks. We think, and I think Dr. Birx is right about this, I think the asymptomatic spread amongst 18 to 35-year-olds is fueling this thing right now, and we can stop that.
So if people aren't willing to wear masks, are they going to be willing to be tested if they're not having symptoms?
Yeah, no, I don't know. A lot of this is the social compact. I get this all the time. Are you going to arrest people? I'm not going to go arrest people on, things. I got to count on their goodwill. We will if there's, you're willfully doing things, but I understand how hard this is. I think it's especially touchy. I've gotten criticisms that I haven't cracked down on these political rallies. I've asked campaigns not to do it. If they willfully choose to do it, I think it's sending a strong message. Participating in the political process is a sacred right. I totally understand. You don't get to arbitrarily decide if you're going to stop at a stop sign or not because you're not a good driver, and not because it might not be safe to go through. It's because of the inherent risk to others. So I'm just going to ask again, and I think one of the things that's going to come home here, this is not going to get good over the next few weeks. And again, the politics of being a little pessimistic about that's not pessimistic. That's facts and that's science. I am optimistic about a plan. Hopefulness that this is just going to quit or it's going to go away or it doesn't get you is not a plan. And I think this plan of aggressive testing, contact tracing, of asking people once again, and I keep getting asked about this, are you going to shut things down? Well, people aren't going to adhere to it. It's not nearly as effective as if the conscious, proactive choice of wearing the mask and doing the social distancing. So we're going to still encourage folks.
2 questions. One, going off what you just said, when is it that the risk to public safety overrides quote unquote personal liberties, in your opinion? And then 2, did you choose to come here to Moorhead because of any specific risk coming from North Dakota or Clay County or Cass County?
Yeah, no, I think just coming here, one thing is we have a very robust public health. It was to thank them. And again, I don't want to pass judgment here on this. I know decisions were made, and I think history will write that mitigation and spread was slowed. But again, those borders are arbitrary. As one nation, it's pretty obvious right now, we have done this as poorly as any planet on Earth, or any nation on Earth. With that being said, I think there's been some real robust efforts around states doing it. That public has those civil liberties, but we do that often. Again, on simple things, the yelling fire in a crowded theater. You know, that there's an infringement on the First Amendment if you took it for that, but that's not the way it's been viewed, that outweighs it. I think we're at a point right now with this spread, and I look at the numbers. I'm trying to figure out what's the best things to get compliance, and I don't disagree that voluntary compliance is the best way to do it, but at some point in time, you've got to put some guardrails in, some speed limits, if you will. We've done that. I know several states have taken a different approach. And it should be absolutely apparent that the results will be more spread of the disease. The interesting thing about this is, and we're seeing this with some of the data, making those decisions doesn't necessarily mean your economy is going to improve or your growth, because once again, people said, well, there's too much government here, and we're not going to do public health checks of kitchens. So if you get salmonella, good luck. Well, the free market will work in that regard, because if you have a business, a restaurant where people get food poisoning, people will not go there. The same thing is holding true about COVID. People are now getting more and more nervous about going to those places.
Governor, you're suggesting that testing is going to make a big impact, and yet North Dakota tests at higher rate per capita than any other state, and yet we lead the nation in deaths per capita. So how do you square that?
No, you're right. It's what you do with the testing.
What's Governor Burgum not doing?
Not the contact tracing and not implementing the mitigation efforts then once people have it, because of I would argue either a mask mandate or how you deal with indoor facilities or whatever. You're absolutely right, and I think North Dakota, they're as good as anybody at doing this. They managed it. You have a relatively rural population, but if you test and then you tell people that it's up to them whether they go into places or not, or whether they quarantine, then you lose the impact of the test.
So how are you going to use the testing data to mitigate it better?
Yeah, well, again, hopefully we're going to make the case from an education standpoint that these 18 to 34-year-olds, because I want to be clear about this. I think it'd be a rare individual who doesn't care about sick. I'm not saying that at all. I just think, again, the same thing came with chicken pox. Because if you could see it, it would make all the difference in the world. And I think not seeing it makes it hard. So I think we're going to try and make those things available. We're going to ask for voluntary compliance.
North Dakota colleges were actually incentivizing students to go get tested. Are you thinking about doing something like that?
You know, we've talked about it. It's a great idea, and I do think, I want to note that I think we're watching and learning from North Dakota around testing. They are doing a fabulous job. Here's what I think. I think the early testing and what North Dakota did, coupled with some of the mitigation efforts we took, together would have probably been a strategy. But that's one of the things of 50-state strategies, and certainly criticizing someone else when our own holes in our strategy is not the way to go. But I think this issue, up to me, and I know this as a teacher to be true, is the surest way to not get compliance out of your students was to tell them not to do something. Surest way, don't do that. Don't look under that door. Oh, I'm looking in that door. Positive reinforcement is the thing, and there might be some case in that. That is a good point. Yeah, I can take two more, Caleb.
One last question. So knowing what you know today, if we went back to early March, what would you do differently in March than what you've done?
I think I would have done the mask mandate then. I tried later, but I think I would have had more success at that time to get it bipartisanly to pass through the legislature together. I think if we'd have passed a bipartisan piece of legislation by legislators and I would have signed it rather than me doing it, that probably would have done it before it got a chance to get kind of political. I think in understanding, maybe would have gone back. I think maybe keeping small retail open a little more earlier. Once we saw the essential services that we were using CDC guidance, we weren't quite sure about that. I think there could have been a little bit quicker around that. And then I think we did it early, and I'm glad we did, but we probably should have been a little sharper elbow of cutting people out and trying to get the PPE of what we did. We became a free-for-all out there. I mean, just this week, one of the problems, this might be a scoop for some of you, there's problems with shipping on the waters, of moving stuff off shipping ports and in, and we're losing contracts around gloves, and 40 million gloves. Now, it sounds like a lot, 40 million gloves. In Minnesota, that's about 2.5 weeks worth of what we need. I believe that's the proper number. And that contract got canceled, so we're out there trying to use this. And again, here's I think the positive about this. Private sector folks working with us from large companies like Ecolab, Doug Baker sent one of his vice presidents over who is an expert in global supply chain, and they've been the one that's helping us. We have found masks in warehouses in Austria that were sitting there, that someone knew somebody who did this and that construction job didn't go through. These N95 masks are sitting there, and they found these things to send them over. So yeah.
All right, a lot of the 18 to 35 year olds are in service industries and in
Yeah.
industries where they have to be around people a lot and in those
That's right.
situations, and they cannot miss work. What do you say to those people who are in
Yeah,
those
we
situations?
need another stimulus on this, that we cannot put people back into that situation. If you need to stay home or you're high risk or you get COVID, there needs to be compensation. This is not a handout. This is not people taking advantage of the system. This is a public health strategy that says that young worker at Starbucks who went and they stopped by and they got that test, they found out they were there, their phone beeped to all of their friends, and now we have 6 people in Starbucks who can't go to work. There needs to be the capacity to be able to backfill them so that they can make their rent, they can pay their bills, they can isolate to get healthy, and then they can come back to work. And then our responsibility, and I will say this about retailers, especially the hospitality industry, they're doing everything possible to mitigate this. They are wearing masks, they are putting up plexiglass, they are cleaning their facilities, they're doing everything. It's customers who come. It's customers who bring it in. It's customers who then spread it to the staff, or the staff ends up going to, again, a well-meaning fundraiser in someone's garage that ends up spreading it. So we've got work to do. We're grateful you're all here. Again, I would encourage all of you to continue to push on this issue of how available testing is and letting folks know. And then Chris's point was well taken. What we do with that information then falls on the state, or otherwise it's useless.
One last question on there. You have a lot of data coming at you. What are you focused on, and what keeps you up at night?
I'm focused on the community spread numbers, the case positivity, and the ones we can't check down. And I think what keeps me up is when this reaches a critical mass and that people give up, that it's not worth, it's not worth trying to do this. The number that I watch every day, that I have to guarantee Minnesotans that there is a hospital bed, a doctor, a nurse, and all of the equipment if they end up there. And that one keeps me up, because I have to tell you, Minnesotans sacrificed a lot to let us build up that stockpile. I need to make sure that sacrifice then is used really well. So,
Thank you.
Thank you all.
Thanks, Governor.
Thanks, everybody.